The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome back to Meet the Doctor. My guest is Martin Jugenberg from Toronto, and you're a plastic surgeon, correct?
I am, that's right.
And you're also known as Dr. Six.
Yes, Dr. Six is so much easier to say than Dr. Jugenberg.
Yeah, I'm sure it is. How's the meeting been for you so far?
It's been awesome. Lots of good talks, but to be honest, my favorite part is the exhibits.
Is it really?
It's like my little toy store. I've been walking around. I want to buy half the things I see here.
It's like your own mall designed just for you?
Yes. A lot of cool little toys.
So tell me about your practice.
So we are located in downtown Toronto. I also have offices in Dubai, Kuwait, and hopefully soon in Miami. We're working on that, so sort of multinational. But my home is Toronto. In Toronto, we do a full scope of plastic surgery, so everything head to toe, and non-surgical treatments like Botox and fillers. My passion is surgery, so that's where I spend most of my time. I tell my patients my OR is my playground, so that's where I like to hang out. We do pretty much everything but the nose. I don't do noses, but I do everything else.
And so do you have to send people out for noses, or do you have someone else?
We have someone in the office that is a rhinoplasty specialist.
Okay. So how big is your team?
There's four of us plastic surgeons. We have one ENT, facial plastic guy doing the noses. And in terms of staff, I honestly don't know. I think like 20 or 30 people.
Mm-hmm. How did you get the name Dr. Six? Where did that come from?
I've been very active on I guess, online and social media for quite a while. But in 2016, I took the plunge and sort of really dove into it. And we were thinking of a name. There's a lot of different options. Right at that time, Drake came up with his song, The Six. And so it's like, yeah, The Six. It sounds better than Dr. Toronto, and definitely easier to spell and pronounce than Dr. Jugenberg. So I went with that. I had no idea how good it was going to be. I like, okay, fine. People love it. Patients love it. It's really the simplicity of it. And it makes people wonder, what is Six? What is he talking about? Like, people from Toronto know what the Six is. It's like the term for Toronto. But everybody else is like, what's a Six? Is your work like a 6 out of 10? I'm like, no, it's a 6 out of 5.
Good answer. So Six is like a nickname for Toronto.
Correct.
Wow, I learned something new today. It works.
Yeah.
How did you come to build your practice in Toronto? Did you grow up there, or did you move there?
No, I'm actually an immigrant refugee from the former communist bloc. So I moved to Canada in '89, went to high school and all my postgraduate studies in Canada and in the States. And then I actually was in the States for my fellowship. I was in the Memorial Sloan Kettering Cancer Center in Cancer Microreconstruction Fellowship, and I was looking to maybe move to Miami, but we ended up deciding to go back to Toronto. Started out as a reconstructive microsurgeon, but fairly quickly transitioned to cosmetic surgery. I worked with some great plastic surgeons in Toronto, and it just came natural. It wasn't something I sort of planned on doing, but it just kind of happened, and I built the Six Surgery clinic, and we've been having fun ever since.
How did immigrating to Canada impact the way that you looked at your education and that path forward?
That's a very tough thing to do. When we came to Canada with my parents, we were truly refugees. We had nothing. We didn't move to Canada. We escaped with nothing. So we came here. That was a traumatic thing, especially I was 13 at the time, so that's probably a good age. But, like they say, if it doesn't kill you, it makes you stronger. Mm-hmm. I feel like that experience made me a little more resilient to stress, to challenges. I pushed through. It wasn't easy, but I just kept pushing through, and I made the most of it.
Do you think about it often, or is it just sort of in the background now?
It's in the background.
Yeah.
It's when we talk about it, I sort of remember it, and I kind of look at it. I'm like, it made me who I am, but I don't think about it on a daily basis.
Yeah, it's not a perspective that most people have.
We're all unique in some way.
Yes, that's true. Do people come to Toronto to see you from all over the world? Well, you go to them too, but
we do have people from around the world contacting us, but now that I have a location in Dubai, I typically send people to Dubai. So if people from around the world contacting us, I just say, hey, I'll be in Dubai. Why don't you see me there? And so I would say Dubai is my international location, and Toronto's more the Canadian location.
Right, it's like the east and the west location.
Yeah.
Got it. And how long have you been going to Dubai?
Since 2020, I think. At 2020.
And
So it's
was
been
there
almost 5 years
anything
now.
particularly challenging about opening up in Dubai?
It wasn't. It was actually through a friend of mine who is from there, and I work at his hospital. So he really brought me on, made it very, very easy. It's been seamless. Very nice, Dr. Katina from Kuwait, great guy, and he's made it super easy. I just show up, and I don't have to worry about the logistics.
How often do you go?
I go every 3 to 4 months.
And then how many people do you see while you're there?
It varies. Lots of different people, very different crowd though.
Yeah.
So what I kind of like about that, it's a very, very different world. Patients are different. North American patients are the type of sort of kind of talk about, they do their Google research and they kind of come and tell you what they want and how they want it. In Dubai, they come to you and say, doctor, here I am. You take care of me. You fix me. You tell me what I need and how it's done.
Do you prefer one over the other?
They both have ups and downs, so
Yeah.
pluses and minuses. What I like is the change. If going to Dubai is kind of refreshing, it changes your perspective. It's a slightly different work environment, and I come back to what I'm used to at home and kind of go with that. So it's the variation. You don't want to be doing the same thing always, all the time. It kind of can get boring. So putting a little bit of variability is a nice thing.
Other than the weather in Dubai, is there anything else that you look forward to? Do you have like a routine?
Everything. I love Dubai. It is just, we could talk about for hours about everything I love in Dubai. It's such a phenomenal place.
What's the first thing you do when you get there?
Check into my favorite hotel and go to the rooftop pool and chill out.
Paradise.
Yes.
Yeah. In terms of what patients seek you for procedure-wise, is there something that you're known for? Is there a specialty?
I am known for my butts, my body work, although majority of what I do is actually breast. So in terms of volume, the biggest chunk of my practice is breast augmentation, but the one that I'm most famous for is my BBLs and body and mommy makeovers.
It's an interesting time in both of those categories because there hasn't been a lot of innovation in breast augmentation. I think it was kind of static for a while, and now there's a lot of new things
We do things
happening.
a little bit differently.
Yeah.
I do what I call tiny scar breast augmentation. So my breast augmentation incision is like maybe 2 centimeters. And I do a couple of different techniques. I do what I call a power boost breast augmentation. So it's a little bit different. Internal bra is something that people talk a lot about. The way I do the internal bra, I use the pectoral muscles. Gives you the rounder, fuller look. It kind of makes me stand out because a lot of people, strive for the more natural look. A lot of surgeons, I mean, and a lot of people think the natural look is the way to go, but you'd be surprised how many women actually don't want the natural look. They already have the saggy breast. They're like, enough. I want a perky push-up look, and so that's what the power boost breast augmentation does. Is it gives you longer lasting, fuller cleavage, rounder cleavage, and some people may look and say, well, that's not natural. Like, yeah, but that's not what they asked for. A lot of women, you would be shocked, don't want to look natural. They want to look like they're wearing a push-up bra without wearing a bra.
There's someone for everyone.
Exactly.
Yes.
And if you do want the natural look, we do what I call the French aug, which is a more sort of a teardroppy look. So we do, like, I don't want to put myself in a pigeonhole and say we only do fake look. We do both, but I do this power boost look, which I think makes us a little bit unique. And there's a lot of people that actually like that.
What about the trends in terms of body contouring and butts? That's changed recently too.
It has. So the demand for the big, round, bubbly butt has gone down, but we still do a lot of BBLs. I like to do what I call the skinny BBLs, which is more of body contouring on a skinny patient. They're not looking for a huge butt. They're looking for curves. From being sort of square, straight, we create a little bit of a smaller waist, a little curve on the waist, a little butt, and it creates a nice little S-shaped curves, contours. So it's contouring, not augmentation.
Have the GLP-1s been as big in Canada as they are here in the United States?
Probably not, but I do have to say I love them. And we have started to offer them at our clinic as well as an adjunct. So we see a lot of people, and we have a strict BMI limit. So patients that don't meet our BMI limits, we suggest, hey, would you like, we can offer you help with weight loss. But aside from weight loss, what I like about it, and it's a little tangent, is all the health benefits. Cardiac mortality goes down, your liver health goes up, lots of benefits. So but that's a whole new topic.
Mm-hmm. It's a great topic.
It's a great thing. Botox when it first came out was used for blepharospasm, and then we've used it for cosmetic things, and now use it for migraines, for depression. There's so many uses, and I think I see GLP-1s, the same thing. People are using for weight loss, but suddenly people realize there's so many other uses you can use it for.
Addiction
is a great
really
thing.
Interesting.
Absolutely.
Yeah.
Absolutely.
I was going to say, nothing will make your butt square faster than losing weight.
Flatter. Yes. And I do have patients that come to me and they're very, very skinny. They've lost some weight. Well, if that's your biggest problem, you're a very, very lucky person.
Let's switch gears a little bit. You make a lot of content, and you told me that in 2016 you jumped right into social media. Do you have a favorite platform that you like to create for?
I used to love Snapchat because of the flexibility, the ability to show content. Snapchat used to allow us to show surgical content, which is what I do. I use social media for education. I show people actual surgeries. I show everything from the consultation to surgery to recovery, giving people a behind-the-scenes view of what takes place. But unfortunately, Snapchat has changed. Mm-hmm. I kind of left Snapchat. I most recently just came back, but I left Snapchat. Now I spend most of my time on Instagram. Unfortunately, all social media platforms look at plastic surgeons as these evil people. We get flagged for content for all kinds of reasons. So it's been a little bit frustrating. I had to change what I put up. I do the talking head things, which is boring and annoying. I'd like to show more of what I do.
Do you find that people are interested in seeing surgical content?
Absolutely.
They like it.
They do. So and our patients like to see things, and I love it as a patient educational. I really do. People always accuse me, you're just doing this for marketing, you're trying to make money. No, I do it for education, because people that walk into my office that have been watching our social media are so much more informed. The consultation is a discussion. When someone walks in my office, I ask them, do you watch our social media? And if they say no, I know this could be a long consultation, and they will have no idea what I'm talking about. People that watch me are amazing. I truly believe that this allows us to educate patients amazingly, and I truly believe that my patients are among the most informed patients. So when we talk about informed consent, big topic in surgeries, most people sign a form. I'm sorry, reading a form or talking to a doctor who talks to you and you have no idea what they're talking about, that's not informed consent. My patients have informed consent, and I love it.
They do. Informed consent is a really big deal, and people in plastic surgery who aren't prepared for recovery are the most dissatisfied. It has nothing to do with their results. They just didn't know what was going to happen.
If you don't set realistic expectations, it doesn't matter what you do. You'll have an unhappy patient.
Yeah. And we don't want unhappy patients because they don't refer their friends and their family, and they don't come back.
Yeah.
So
why would I want to take on a patient I know is going to be unhappy?
Right.
Don't want to do that.
The truth is the only way forward.
Absolutely.
Any advice that you have about social media for others who might be listening?
Very simple. Keep it simple. Don't try to be fake. Be yourself. Whoever you are, put it out there. Don't try to fit a mold. You see people doing stuff, try to copy them and put on a personality or something. Just be yourself. Do your stuff, and people will click with that.
Don't copy what other people are doing. I think that's so important.
Don't be fake.
Yeah.
Don't be fake, because being fake is like lying. It doesn't work.
No. And when you're authentic, the people who you want to come in, they will find you and
exactly.
They will show up.
There's 8 billion people out there.
There's a lot of patients.
I'm sure you can find a group that likes what you have to offer.
Yeah. Where can we find you online? Is it all Dr. Six? If we just Google Dr. Six, will we find all of you?
Go on Instagram. On Instagram, you're going to find me on Real Dr. Six, Real DRSIX. On YouTube, we have our YouTube channel called Six Surgery. So that's the place to go. We also have TikTok, which I hate. I don't like the platform. But we have YouTube, we have Instagram, we have TikTok, and then our website, torontosurgery.com. But if you really want to see what's going on, follow us on Real Dr. Six, Real DRSIX, Instagram, yes.
I will make sure we put that in the show notes. And
awesome.
Easy to find. Thank you so much. It was
Thank you.
Really interesting hearing about you.
Thank you. Nice chatting with you.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.